put down the bottle she was holding, and followed him to a green door at the rear of the laboratory. Inside, Kramer said, you will find a small anteroom, a shower, and a dressing room. Strip, shower, and put on a clean set of lab coveralls and slippers, which you will find in the dressing room. You'll find surgical masks in the wall cabinet beside the lockers. Go through the door beyond the dressing room and wait for me there. I'll give you 10 minutes. We can do this both ways, Kramer said, as he joined her in the narrow hall beyond the dressing room. We'll reverse the process going out. You certainly carry security to a maximum, she said through the mask that covered the lower part of her face. You haven't seen anything yet, he said as he opened a door in the hall. Note the positive air pressure, he said. Theoretically, nothing can get in here except what we bring with us. And we try not to bring anything. He stood aside to show her the glassed-in cubicle overhanging a bare room dominated by a polished steel post-mortem table that glittered in the harsh fluorescent lighting. Above the table, a number of jointed rods and clamps hung from the ceiling. A low metal door and a series of racks containing instruments and glassware were set into the opposite wall, together with the gaping circular orifice of an open autoclave. We work by remote control, just like they do at the AEC. See those handlers? He pointed to the control console set into a small stainless steel table standing beside the sheet of glass at the far end of the cubicle. They're connected to those gadgets up there. He indicated the jointed arms hanging over the autopsy table in the room beyond. I could perform a major operation from here and never touch the patient. Using these, I can do anything I could in person, with the difference that there's a quarter-inch of glass between me and my work. I have controls that let me use magnifiers, and even do microdissection if necessary. Where's the cadaver? Mary asked. Across the room, behind that door, he said, waving at the low, sliding metal partition behind the table. It's been prepped, decontaminated, and ready to go. What happens when you're through? Watch. Dr. Kramer pressed a button on the console in front of him. A section of flooring slid aside, and the table tipped. The cadaver slides off that table and through that hole. Down below is a highly efficient crematorium. Mary shivered. Neat and effective, she said shakily. After that, the whole room is sprayed with germicide and sterilized with live steam. The instruments go into the autoclave, and 30 minutes later we're ready for another post-mortem. We use the handlers to put specimens into those jars, he said, pointing to a row of capped glass jars of assorted sizes on a wall rack behind the table. After they're capped, the jars go onto that carrier beside the table. From here they pass through a decontamination chamber and into the remote control laboratory across the hall, where we can run biochemical and histological techniques. Finished slides and mounted specimens then go through another decontamination process to the outside lab. Theoretically, this place is proof against anything. It seems to be, Mary said, obviously impressed. I've never seen anything so elegant. Neither did I until Thurston's disease became a problem. Kramer shrugged and sat down behind the controls. Watch now, he said as he pressed a button. Let's see what's on deck, man or monkey. Want to make a bet? I'll give you 2 to 1 it's a monkey. She shook her head. The low door slid aside, and a steel carriage emerged into the necropsy room bearing the nude body of a man. The corpse gleamed pallidly under the harsh, shadowless glare of the fluorescents in the ceiling as Kramer, using the handlers, rolled it onto the post-mortem table and clamped it in place on its back. He pushed another button and the carriage moved back into the wall and the steel door slid shut. "That'll be decontaminated," he said, and sent back upstairs for another body. "I'd have lost," he remarked idly. "Lately the posts have been running 3-1 in favor of monkeys." He moved a handler and picked up a heavy scalpel from the instrument rack. "There's a certain advantage to this," he said, as he moved the handler delicately. "These gadgets give a tremendous mechanical advantage. I can cut right through small bones and cartilage without using a saw." "How nice," Mary said. "I expect you enjoy yourself." "I couldn't ask for better equipment," he replied non-committally. With deft motion of the handler he drew the scalpel down across the chest and along the costal margins in the classic inverted Y incision. "We'll take a look at the thorax first," he said, as he used the handlers to pry open the rib cage and expose the thoracic viscera. "Ah, thought so. See that?" He pointed with a small handler that carried a probe. "Look at those lungs." He swung a viewer into place so Mary could see better. "Look at those abscesses and necrosis. It's Thurston's disease, all right, with secondary bacterial invasion." The grayish, solidified masses of tissue looked nothing like the normal pink appearance of healthy lungs. Studded with yellowish, spherical abscesses, they lay swollen and engorged within the gaping cavity of the chest. "You know the pathogenesis of Thurston's disease?" Kramer asked. Mary shook her head, her face yellowish white in the glare of the fluorescents. "It begins with a bronchial cough," Kramer said. "The virus attacks the bronchioles first, destroys them, and passes into the deeper tissues of the lungs. As with most virus disease, there is a transitory leukopenia, a drop in the total number of white blood cells, and a rise in temperature of about 2 or 3 degrees. As the virus attacks the alveolar structures, the temperature rises and the white blood cell count becomes elevated. The lungs become inflamed and painful. There is a considerable quantity of lymphoid exudate and pleural effusion. Secondary invaders and pus-forming bacteria follow the viral destruction of the lung tissue and form abscesses. Breathing becomes progressively more difficult as more lung tissue is destroyed. Hepatization and necrosis inactivate more lung tissue as the bacteria get in their dirty work, and finally the patient suffocates." "But what if the bacteria are controlled by antibiotics?" "Then the virus does the job. It produces atelectasis followed by progressive necrosis of lung tissue with gradual liquefaction of the parenchyma. It's slower, but just as fatal. This fellow was lucky. He apparently stayed out of here until he was almost dead. Probably he's had the disease for about a week. If he'd come in early, we could have kept him alive for maybe a month. The end, however, would have been the same." "It's a terrible thing," Mary said faintly. "You'll get used to it. We get 1 or 2 every day." He shrugged. "There's nothing here that's interesting," he said, as he released the clamps and tilted the table. For what seemed to Mary an interminable time, the cadaver clung to the polished steel. Then abruptly it slid off the shining surface and disappeared through the square hole in the floor. "We'll clean up now," Kramer said, as he placed the instruments in the autoclave, closed the door and locked it,